So we looked at the stages of how a microbe causes an infection, causes disease. Let's look at the actual stages of an infection from the patient point of view. What's the patient going to, what's going to happen to them? How are they going to present through the course of this infection? When you look at the graph here above my head, you'll see that there are, 2, 4, possibly 5 stages. Different stages or periods within an infection. First stage, first period is what's called incubation. Just because right now, boom, a microbe just got into your body. Either your sinuses, you drank something, ate something, whatever. You're not immediately going to get sick. You're not immediately going to have an infection. It's going to take time for those first few stages we just talked about of infection and disease from the microbe's point of view. It's going to take time for the establishment of that microbe, for it to start to grow, for it to increase in numbers. This is the incubation time. Incubation time varies depending upon which bacteria, which virus, which parasite you're talking about. Influenza, 7 to 10 days. Somebody sneezes, who has the flu, you just breathed in the micro droplets, and within those micro droplets are going to be virus particles. 7 to 10 days is this incubation period. It's going to take 7 to 10 days for that virus to get in, to establish, and get into some host cells. The incubation period for some bacterial infections could be days, could be as few as hours, short as hours, depending upon what it is. Incubation period segues into the prodromal stage. Prodromal, you're not feeling quite right. The microbe is beginning to do damage. It's the beginning of the damage. Your body is starting to recognize that there might be something there, not you. And then this leads into what is called the acute phase. You're sick. You got the signs and the symptoms of being sick. You've got a if it's the influenza flu, you've got a fever, you're vomiting, you feel like poo, you're dizzy, you're achy, all this stuff. You're sick. If it's, a bacterial infection, the site of the wound or whatever is now red, it's inflamed, it hurts. Your immune system is mounting and it's coming to clear it out. And you're sick. This is what you think of when you think disease, you think infection. This is that period. The incubation, the prodromal, you have an infection, you just don't know it yet. Sometime within the acute phase, your immune system completely kicks in. It finally catches up. And it takes some time for your immune system to kick in. And that's good. You don't want it to kick in quickly because then it overreacts to things and it acts like your allergies. Or, ooh, boom. Now things just don't feel right. So if it's the first time you've ever been exposed to something, it could take 2, maybe 3 weeks for it to kick in completely. If it's the subsequent times you've been exposed to the same microbe, bacteria, virus, now it's down to just a few days that it'll kick in, it'll come, and it'll attack. The white blood cells that are on patrol, they're there instantly. They're there. Once they come into contact, they attack. Within hours, even more are there. But the B cells, the T cells, that's going to take time. And once everything kicks in, you hit that convalescent period. the clearing out of. The infection, depending upon what it is, it can be cleared out. If it's a bacterial infection with no secondary issues, no secondary infections, no problems, if it's just a regular staph infection or whatever, because you got a cut, your immune system will actually clear that out within a couple of days. The reason why it's still inflamed, the reason why your flu feels like it's hanging around for 2 or 3 weeks, the flu virus is gone. What you now have is the inflammatory response. Your immune system is still hyped up. It is still looking. It's still on patrol. It's still go, go, go. And it takes time for it to ease down, to slowly pull back. That's the convalescent period. Near the end of the convalescent period, the disease is gone. Your inflammatory response, your immune system is slowly ebbing away, and you're convalescing. You're starting to feel better. You're not quite back to where you were before the infection, but you're getting better. You're replenishing reserves that were depleted because of the infection. And the convalescent, you're good. No disease, no issues, no signs, no symptoms, good. That fifth phase, well, there's an alternate. For some people, depending upon the infection, depending upon what's going on, they can get into what is referred to as a continuation phase. What should have been an acute, incubation, prodromal, acute phase, convalescent, and done, it kind of tapers, but it never completely goes away. It's almost like a chronic phase. Again, example here in 2020, COVID-19. For that small percentage of people who do get sick because of the COVID-19, because it's there, they get the disease, they get a severe disease. Some clears up. They're good. Once the disease is over, they're released from the hospital within a few weeks. They're up and about, almost back to normal. Within a couple of months, they'll be okay. A very, very, very small sub-percentage of individuals, it just kind of lingers. The level of infection may be low enough that they can't quite find it, but their immune system's never quite quieting down enough. The continuation phase.